my name is Stephanie Stamas and I'm a physical therapist at Beyond Basics Physical Therapy. So today we're going to be talking about what is pelvic congestion. So pelvic congestion is just when there's varicose veins in the pelvis. When there's varicose veins in the legs or in other areas of the body, you can usually see them, but sometimes it's really hard to see them in the pelvis, especially for women. When there's varicose veins in the pelvis for men, this can present as a testicular varicocele, and the man can actually feel it or the doctor will feel it. But when it's in women, it's actually stuck inside the pelvis, so sometimes it's really hard to know if you have a varicose vein. The veins can be problematic because when the vein pulls with blood, it can put pressure on the nerves, on the muscles, and it can even just lead to a feeling of a lot of pressure and heaviness. In general, if you have pelvic congestion, your symptoms are far better in the morning because when you're lying down while sleeping, the blood is able to get back into the circulation system and it doesn't pull in your pelvis. So the typical pain pattern is better in the morning and it gets worse throughout the day, and especially with prolonged standing or sitting because gravity is going to push the blood down into the pelvis. Also, another common finding is that you tend to have more pain on the left side versus the right side because of the way the anatomy is set up. So if you look at this picture, this just to give you a little orientation here. This is the inferior vena cava. These are the ovarian veins, and these are all the uterine and ovarian vein plexus down on the bottom here. So if you look to see how the blood comes back up into the circulation system, on the right side of your body, it enters the inferior vena cava at about a 45-degree angle. On the left side, however, it doesn't go into the inferior vena cava, it goes into your renal vein at about a 90-degree angle. So if you imagine this is really bad traffic, you're getting on a highway at 5 p.m. on a Friday in New York City, trying to get on a highway at a 90-degree angle would cause a lot of backup in the system, versus trying to get on a highway at a 40-degree angle will allow you to smoothly transition into traffic. So just based on the anatomy, there tends to be more backup on the left side than the right side. So this is why sometimes you can have more left-sided feeling of heaviness and pain versus right-sided, although that's not for everyone, but sometimes it can be a common finding. So if you do have pelvic congestion, finding the right physician and getting into the right hands is very important because it is something that can be treated medically. So if you have any more questions about it, feel free to call our office or come in for a consultation.